Okay, so actually, we didn't have anything exciting. You're too normal. Now I'm going to go on to the abdomen. Now there's something really wrong with the positioning here. First of all, her knees are not bent. Her abdomen's not going to be soft. Now I'm going to actually put down the head of this cute little bed, and I just wanted to point out, if you flex the head, could you hand me one of those gowns? Please, thank you. If you flex the head, it automatically softens the abdomen. Now, if we furthermore bend the knees slightly, the abdomen is even more tender and soft. So, first thing we want to do, may I? Thank you, I appreciate it. Is first of all, we want to look at the shape. So this is a pretty flat abdomen. Good for you. Now, we also are going to be looking for striations, scars. There are some scars, or actually those are striations over here in the left lower quad. Your instructor may ask you about colors of striations, so be aware of that. And I'm also focusing on the upward pulsation of the carotid. Now, as she exhales, you can see it very nicely right here. So it's about 1 centimeter lateral to midline. You can see it right there. Now take a look. Now here's another thing that I'd like to point out. Remember we talked about the bifurcation? Right here, below the umbilicus, you can see 2 upward pulsations. And that's really noticeable on thinner people. Right there. So you see, that shows you that the bifurcation is indeed as I said it was, or where I said it was. Now let's talk about my little guide to renal arteries and iliac arteries. So, imaginary line at the belly button, imaginary line at the bottom of the ribs, right there. So we extend the midclavicular line down. Now, same idea, and here are the iliacs. And then we've got the superficial femorals. Pretty neat. All arteries are capable of having stenoses because of plaque problems. So first of all, I've already done my inspection. I've got to listen to those sounds. Woo! She's got... But. Are you hungry?
I am.
Oh, busy in here. Busy. Now, if you get bowel sounds in one quad, you're off the hook. But before you run and tell the doctor, there are no bowel sounds, you better listen for 5 minutes. Otherwise, you kind of look foolish, because you see, you're sending an important message. You're sending him the message or her the message. There might be bowel ischemia, peritonitis. So she's got good bowel sounds. Now, I'm going to use the bell. Remember how we use the bell for the carotids for my vascular sounds. So notice where I listen to the aorta, high up. Now, on the sides is where I can capture the renal arteries. And I hear nothing but bowel sounds. So I want you to do this for me during your practicum, iliac arteries. Now, we can describe that there are no femoral bruits as well. Now, you will be able to find the femoral pulse easily on your patient. Now, here comes the fun stuff. Percussion. Okay. Running on empty. Mm-hmm. Shall we go buy you something? Oh, this is great. Empty, empty, tympanic to percussion. Now, this is the great thing. I love this. Okay. Now you tell me when you hear dullness. Now I'm going right up the midclavicular line. Now she was guarding a little bit because when I hit, it's hard. Okay. Now that was pretty dull, wasn't it? So we know her liver's here. Now. Different. Do you hear the difference? That's resonant. So I've come down from the top and I went up from the bottom. So I've got her liver right here. So I know that her liver is like this. This is what we call the liver span at the midclavicular line. It's going to be 6 to 12. Yeah. Now yours is probably about 7 because you're a small female. But wasn't that fun? Mm-hmm. All right. Now, what are some ways that you can palpate? Now, nurses do light palpation first to double check for tenderness. Now, let's say I elicit some tenderness here in the right lower quad. I'm not going to go straight there and go, ah! The reason is of course, is that once I've done that, I've destroyed my exam for the other quads because she's going to guard. Everything gets hard, like, oh, don't touch me. So that'll be my last quad if that was the problem. Now, for a deeper palpation, some people use this nice rocking technique, and you are going in a lot farther. Now, I'm not going to do rebound tenderness on Harmony because I like her. But what I will do is I'm going to do some deep palpation of the liver, and this is what your practicum is about today. I put my left hand underneath the thorax. Now, I'm just going to review with you. If you have the person inhale, what's happening with the liver? It's coming down. I'm not going to stick my fingers in then. I'm going to ask her to exhale. Now I'm going to actually put my fingers in below the ribs. Now notice I'm not moving. Now inhale please, and hold it. Now is when I palpate. No liver tenderness. Now you can also do the liver hook. This is way fun. Okay, now you can inhale, exhale. Now my fingers curve in, inhale, and hold it. Now some people like the liver hook better. Now for the spleen, again the left hand. Now I'm just going to help her over toward me. Now inhale please, exhale, inhale and hold it. I didn't hurt her, did I? Same regimen, but you have to think about what you're doing. Now I get very upset when people stick their hands in during inspiration. That's one of the reasons, it's a small critique I have of the film. I think I was taught to do the exam in a real good way. Now I wanted to teach you some extra tricks. Now let's say someone has ascites due to liver failure. What's something you could do to get the lower border of the liver? This is fun. If you put the stethoscope over where we know the liver is, which is under the rib cage here, and you scratch, the sound gets very, very much louder suddenly when you hit the lower border of the liver. And that's a wonderful thing to try. Now, let me just kind of show you where I would go next week, and we're going to do all of the neuromuscular. So we're going to practice the whole thing. Is that, notice that I've already evaluated the right hand pulse. So I check for capillary refill, it's good. Now I'm going to reach across, I'm going to check the pulse, check for capillary refill. You're a little blue today, you'll be okay. And then this is what I do in real life. Now I'm going to go down to the leg and I'm going to do range of motion. I'm going to do some strength tests, and then I'm going to go down to the foot. So I don't waste time. And experienced examiners are very, how do we put it, succinct in what they do. So what I'd like you to do is bring your leg up straight. Okay, put it down. Now bend your knee, bring it to the chest. Good. Okay, bring it out. Cross midline. Perfect. Now put your heel down. Now what we're going to do is bend the leg, and we're going to check for hip rotation. So her range of motion is perfect. Now here comes the fun part. Now what I want you to do is to lift your leg up straight. I'm testing the quad against my hand. She offers strong resistance. Now bend your leg. Now push down against my hand. Now that's her hamstrings. Could you hand me a paper towel since I don't have gloves? Now we're going to do range of motion of the ankle. Pardon me. Now, can you bring your toe towards your nose? Okay, can you point towards me? The toe towards me. Now point this out. Point this here. range of motion of the ankle. Now let's do strength. Now pull against my hand. Whoa. Now push against my hand. Great. Now we can do Babinski, which I'll teach you next week, and we can also check for Klanas. Okay, could you sit up, please? That was fun. Now let's do the upper extremities. Now if you do one leg correctly, I'm happy. I will be very happy. Now let's move our arms forward like this. Forward flexion, extension. Now, I know you can't do this on the left arm, but lift your arms up like this. Perfect. Now put the elbows to the waist, and we're going to do flexion, extension. Now for the wrists, so the palms down, bring your hands up, bring them down, move them inward, move them outward. Good. Let's try fingers now. Fist and a ring. Okay, now we're going to do strength. We go from big to small muscle. Now, bring your arms up against my hands. That's shoulder girdle strength. Now, if I have her push up against my arms, what muscle am I isolating?
Biceps.
Biceps, good. Okay, push up against my arms. Okay, good. Now push down. Good. Now, we can do this in one hand. Now push against my hand. Now pull against my hand. Great. Now open the fingers up. Great. Now cross your fingers for good luck. That's for me, not for you. I need more good luck than you. You squeeze this finger. Great. Excellent. Now make a little ring. Now this is not important for the generic exam, but if somebody has an arm injury or neuropathy, a lot of times they're weak in this movement. So I just like to teach it as one of those things that you can add on. Now the great fun is, now that we've done strength, movement is, yes, someone falls over, overcome with all this knowledge, would be the biceps. And we will be doing this with hammers. I'm just kind of doing this as kind of a party joke for you, but you can palpate the biceps tendon. And now, if that was natural, that's great. Maybe you're part of the party trick too. Okay. Now, that movement actually is the biceps tendon. And you saw that. It doesn't take much to elicit. See how nice it was? Now I'm going to show you the end of the day Achilles tendon test. Oh. All right. Now, end of the day, does anybody want to take his or her shoes off? No. Take the shoelaces, or the bottom part of the shoe. See how nicely? See them? Okay. So you're going to do the reflexes for me, and then we'll go on to sensory tests. But see how quickly that goes? Mm-hmm. And even with all the jabber, which you're not going to engage in, right? It goes quickly. Mm-hmm. Thank you very much. Yeah, what a good sport you were. Now someone who needs to buy her coffee or something, something to eat. Okay, thank you.